Hey guys, this is Dr. Girmann with Inertia Medical. Welcome back. Today our topic is something that I wrote an article about a couple of years ago, and that topic is, what are we to do after we get injured? And the title of the article was actually wrong about R.I.C.E, question mark. And R.I.C.E is an acronym that stands for rest, ice, compress, and elevate. Some of you are pretty familiar with that, and that acronym actually came from a Dr. Mirkin in the 70s who wrote a book that I think was called the Sports Medicine book. Pretty self-explanatory, and in that he provided recommendations on things to do to abbreviate or shorten the duration of symptoms and to return to activity more quickly. So since that time we've learned quite a bit more, and in fact Dr. Mirkin himself has come out to say, hey, maybe I was wrong about a couple of those things, or newer information has provided us with ideas of things to do a bit differently after we get injured. So one of the things we do differently relates to rest. We used to tell patients, hey, rest is best. After you experience an injury, say it's a low back injury or a sprained ankle, or even a mother who just delivers their child, we used to say, hey, bed rest is encouraged for days, sometimes weeks. The body needs to chill out, the body needs to heal. But now things are quite different. We encourage movement, and we want people to get up as soon as they can, as soon as it's tolerated. And the reason for that is because movement is therapeutic. It's medicinal. It encourages new blood flow and nutrients to go to the damaged area. It carries away certain waste products, and movement can actually be instructional. It can provide instruction to the damaged area, to the cells in the damaged area, and I'll try to provide an example of that. So if you consider a tendon with dense, well-organized collagen fibers, that tendon is pretty strong and robust. But if it does experience an injury, the body can lay down additional connective tissue or collagen fibers to make it strong again. And just as a builder who doesn't have proper instruction or blueprints might build a building in a sloppy fashion or in a disorganized fashion, so too might the cells lay down collagen in a disorganized sort of arrangement. And that structure is nowhere near as strong as we would like for it to be. But when you move and there's some force placed through that damaged area, it tells the cells how they need to heal. It tells the cells we need to lay down collagen in a very specific, organized fashion so that we're nice and strong well into the future. So hopefully that makes some sense, but movement is very, very important in the healing process. One of the other things that has changed a little bit applies to the use of ice. So we used to tell patients, hey, use ice liberally. After you injure yourself, in order to keep inflammation and swelling at bay, grab a bag of ice and grab a frozen peas out of the freezer and just leave it on that area all day. But now we recognize that ice ought to be used a lot more sparingly. And the reason for that is that inflammation and the swelling is there for a reason. It's a part of the natural healing process. Just like when you experience an infection, your body mounts a response in the form of a fever. That elevated temperature serves a purpose. It helps to kill off some of the microbes that are causing that infection. Well, similarly, the inflammation and the swelling after an injury serves to initiate the rest of the healing process. So the dilated blood vessels that cause the swelling also bring to the area many different healing cells, which clean out some of the damaged debris and allow for new healthy tissue to be laid down. Again, it also removes certain waste products. So when we use ice, it clamps down on those vessels and doesn't allow for those processes to take place. So a little bit of a different way of thinking there. I mentioned in the article that if we forget about the acronym R.I.C.E, we might want to remember compel. Thought I was a real genius when I came up with this one. It's just the two remaining recommendations, compress and elevate, because those things still seem to be pretty helpful in the setting of acute injury. So again, times are a-changing. If you want to learn more about that, you can in fact check out that article on inertiamedical.com. But if you have any questions, feel free to shoot them our way, info@inertiamedical.com.